Mr. Burton.
Chairwoman Woolsey, Ranking Member Rogers, Congressman Payne, and other members of the Subcommittee on Workers' Compensation, thank you for the opportunity to testify about workers' compensation. As you know, each state has a workers' compensation program that provides cash benefits, medical care, and rehabilitation services. There are no federal standards for the state workers' compensation programs, and as a result, there are substantial differences among jurisdictions in terms of level of benefits, coverage of employers and employees, and the rules used to determine which disabled workers are eligible for benefits. Over the past 100 years, there have been periods of reform and regression in workers' compensation. As an example, the level of workers' compensation cash benefits declined substantially in the decades immediately after World War II, and one consequence of this deterioration was the creation, as part of the Occupational Safety and Health Act of 1970, of the National Commission on State Workmen's Compensation Laws. The National Commission issued its report in 1972, critical of state workers' compensation programs, described them as, in general, neither adequate nor equitable. And the National Commission made a number of recommendations for state programs and described 19 of them as essential. And in the aftermath of the National Commission's report, there were substantial changes in a number of state laws, improving these laws, but that improvement has come to a halt, and if anything, a decline. At the risk of oversimplifying the last 40 years, I would say the 1970s were a Reformation period, the 1990s was a relative tranquility period, and the years since 1990 are the counter-Reformation period. A number of states changed their laws during the 1990s to reduce eligibility for benefits in contrast to the historical standards for compensability in workers' compensation. And Dean Spieler and I have written extensively on those developments. There's also been research to quantify the impact of these changes in state laws, and I'll mention some work that I've done with Professor Steve Guo, and I have looked at changes in state laws during the 1990s and found that these changes in levels of benefits and in compensability standards were the major source of the decline in cash benefits during the 1990s, more so than the decline in the injury rate. There have been changes during the current decade that continue this process of cutting back on state workers' compensation laws, and I mentioned several of these in my written testimony, which I'll skip over here. Now, the Social Security Disability Insurance Program is the largest income replacement program for non-elderly Americans, and as you know, this is a federal program with federal rules that are standardized throughout the country. Workers' compensation and the SSDI program serve overlapping, although not identical, populations. And Congress has been concerned for a long time about the relationship between workers' compensation benefits and SSDI benefits. Since 1965, there has been a provision requiring that the combined total of the two benefits not exceed 80% of pre-injury earnings. And Congress has continued to be concerned about this issue, have made some subsequent changes in these offset provisions. I think there's several reasons why Congress needs to be concerned about the possible shifting of costs from state workers' comp programs to the federal SSDI program. For one thing, you have the 15 states which essentially reduce workers' comp benefits as a way of making sure the combined total of SSDI and workers' comp do not exceed 80%. There are also reasons to be concerned because of the fact that safety incentives and workers' compensation depend upon the costs being charged back against employers. To the extent these costs are shifted, we have a reduction in the safety incentives from workers' compensation. There's some evidence about the cost shifting that's in the paper. Again, some work that Professor Guo and I are doing, indicating that the changes in the 1990s were in fact responsible for some portion of the increase in SSDI applications during the 1990s. There's mixed evidence on this question. We're doing additional research, but I think there's at least, if not a red flag, an orange flag here that's waving, saying we need to be concerned about what's happening in workers' comp because of its impact for SSDI. I suggest some policy changes for workers' compensation. In my own view, federal standards for workers' compensation are desirable. I note in here that the National Commission's recommendations were unanimous, and the members of that National Commission were basically Republicans appointed by the Nixon White House. And if it can be done in the Nixon White House, Republicans, no reason why we can't do it in the present time. And I also offer some suggestions for the SSDI program. Federal government has already taken efforts to stop the transferring of medical costs from state workers' comp programs to the Medicare program, and I propose here a modest piece of legislation that would also limit the ability of the states to shift the cash benefit portion of workers' comp into the SSDI program. Thank you. Appreciate your toleration of my going over a little bit here.
Thank you, Mr. Burton.